Good afternoon, everybody. My name is Dr. Philip Williams. I'm an orthopedic sports doctor in Houston, Texas, and I'm here to answer a few questions about any athletic injuries that you may have and answer any questions about recovery. And just here to say hi and see what you are interested in. Thank you for joining. Nana, I see you here. Alexis, I see you here. We're just going to give it a couple more minutes before we start into the questions. Give people a couple seconds to join us and see what we can start talking about. So thank you for coming. I see Mark Butler's in here. Thank you. And I'll start answering some questions in a second. So just give me a second. Once again, I'm an orthopedic surgeon in Houston, Texas, specializing in shoulder, hip, and knee injuries. And I do arthroscopic surgery, minimally invasive surgery for the most part. So thank you for all that have joined so far. We're about to get started. And let me know your questions in the comments. And if I don't get to your question, just be sure to send me a DM or leave a comment on my page. I'll be sure to answer it at some point. So let's get started. So I'm going to try to keep this related to my area of specialty, which is shoulder, hip, and knee. So the first question on shoulder or hip, actually, Nana asked a great question. So any advice if I have bilateral acetabular retroversion? So acetabular retroversion basically refers to the shape and the angle of the hips and has a impact on the way that the hips are moving and can affect stability of the hips. So if you have bilateral acetabular retroversion, sometimes that can affect your stability. And if it is an issue with stability, that's not necessarily something that can be fixed with physical therapy. So I would have that checked out by a hip specialist, and possibly that would have to be corrected with what we call a periacetabular osteotomy, where you move the bone to basically help the hips get to a more anatomic position. So great question. Thanks. So 12x7 says, one doctor told me it was a full tear, another said it was a partial. How do I go about it? So thank you for the question, although you got to give me more information. I don't know what you tore. I'm going to go through some of these questions. Gaming, fitness, life tips. Thanks for your question. Hello, I tore my pec 3 years ago and never got it repaired. Can it still be operated on? Typically, for any tendon tears, you want to try to get to your tendon tear within 6 weeks at the very, very, very least. Ideally, it would be within 2 weeks. So I would say 3 years after a pec tendon tear could be too late for any kind of intervention. If you had an intervention, it would require a reconstruction, which is a bigger procedure and takes longer in terms of the procedure time and possibly recovery time, unless it is actually truly symptomatic. Many times people with long-standing tendonitis or tendon tears may like to have it not fixed. But if you have issues and it still bothers you, it is possible. It's just a bigger operation. Alexis asked, thank you for the question. Any advice for rotator cuff pain management? So rotator cuff tears can be treated non-operatively with physical therapy, working on strengthening the rotator cuff as well as stabilizing the scapula, which is your shoulder blades. And if you do that, it can alleviate some of the pain from a rotator cuff tear. But if the pain and the symptoms are still there, I would suggest doing a consult and discussing whether or not a surgery is necessary. So I have a question from sorry, my foot started. So Sporcher Everett. Sorry if I mispronounced her name. My foot started hurting and I've got it looked at and they don't know what it's been 2 months. So sorry about your foot. I cannot tell you exactly what's happening with that, especially since it looks like a lot of folks are trying to figure out what's happening. Many times the pain can be related to lots of different things, especially if you're an athlete. Sometimes athletes get stress fractures that may require an MRI to evaluate it, even with X-rays or normal. Anthony asks, I rolled my ankle last week. How can I recover from it? How can I recover from it? It happened during playing soccer. So ankle sprains are common with these sports, and you can definitely do some physical therapy, especially with ankle sprains, because physical therapy usually helps to actually strengthen the tendons and ligaments around the ankle to stabilize it. So I'm going to skip around. If I skip your question, please send me a DM or a comment on my page. So sorry if I missed your question. Cody asked, I tore my left hamstring and my rehab has made my lower back glute have severe pain. So because of the proximity of the hamstrings, it can cause some lower back pain. So you have to make sure you strengthen them appropriately, your lower back and your hamstring, as well as core strengthening for any kind of lower back as well as hamstring issues. So that might be why, although I can't tell you your specific issue, but that usually is the culprit. So DJ Customs asks, any tips for sharp elbow pain baseball pitcher? So baseball pitchers they can tend to get elbow issues because of the stress and torque that is placed on the elbow, especially during the pitching motion. It is important that a pitcher, if they have inside elbow pain or medial elbow pain is what we call it, to really have that evaluated, because it can be related to a ligament issue known as the UCL, which can cause significant problems and require surgery. So that is an issue, especially if you are a pitcher, to have it looked at, and if you have regular elbow pain there. Real Peanut asks, what if my kneecaps go back and forth? So people have pain in the front of their knees, typically from what we call patellofemoral syndrome. The kneecap is called the patella, the femur is the thigh bone. So patellofemoral syndrome relates to how the thigh bone and the kneecap are not gliding properly. And that usually is from an imbalance of the muscular forces around the knee. So usually with physical therapy and strengthening the muscles around the knee, that helps to keep the patella or the kneecap stable. So physical therapy is pretty much the standard of care for that. So I have a question about any tips for oscar-slaughter. So oscar-slaughter relates to pain basically at the tibia, the front of the shin bone or the tibia, and that is the result of basically overuse of the patella tendon. So it's an overuse injury where the patella tendon puts a lot of stress on that growth plate, because it happens in adolescents and young kids where the growth plate around the shin bone is too overworked. And the treatment for that basically is rest, physical therapy, and stretching the hamstring and stretching the hamstring and strengthening the quad and hamstring as well. So it's basically rest and physical therapy, and the pain goes away when the growth plate closes, which is age 14 for women and age 16 for men. User some number says, I'm 25 and my shoulder keeps dislocating when I play basketball. How 10 times? So that's a very bad problem, obviously. So shoulder laxity or multiple shoulder dislocations can happen in people who have joint laxity or joint looseness. And one way to improve that is with physical therapy. So people who have very loose joints, especially in their shoulder, physical therapy is pretty much advocated for something like that. But if you had a very bad dislocation where you had to go to the hospital to have it relocated, many times you could have a defect or a problem with the stabilizing structures around the shoulder. So that would need to be addressed sometimes with surgery if physical therapy is not effective. So once again, if I skip your question or miss it, please send me a DM or comment and I'll try to get to it. Chase 3N asks, have a bit of articular cartilage tear in my right knee. Will I need to get it cleaned up? So articular cartilage is basically the cartilage that surrounds the knee to keep it to stabilize, to to cushion the joint. So that's where articular cartilage is joint cartilage. So if you have an articular cartilage tear, which can happen with people who have wear and tear, that could be treated with physical therapy sometimes to alleviate some of the pain. But if it is a big area, it can be cleaned up. But what I prefer to do is I prefer to repair the cartilage either by transplanting new cartilage or having new cartilage grow with the Macy procedure, MACI. So if you have a cartilage lesion and it is bothersome, I would have it looked at definitely with an MRI and consider a cartilage restoration procedure for it, because once you lose the cartilage, it does not get back. So I'm going to skip around. Again, if I miss your question, send me a DM. Ethan asked, my knees hurt when I have them bent for too long, especially sitting in a car for a long time. So this is a very common problem for a lot of people, and it relates to an issue I just talked about as well. This is called patellofemoral syndrome. So patellofemoral syndrome, again, is how the patella or the kneecaps relate to the femur or the thigh bone. And so the way to treat that is basically by strengthening your quadriceps muscles, stretching your hamstrings, and basically working on the muscles around the knee to help stabilize and balance the kneecap, because the kneecap is putting too much pressure on the front of the knee. And then if you have a balanced muscle around the knee, it helps to alleviate that pain. Okay, so Les Carnitas asked, I'm getting my discoid meniscus repaired on Friday. How much pain am I going to be in? I'm scared. So I hear you. I hear your anxiety about surgery. A lot of people are definitely anxious about surgery just because no one has surgery all the time. And I can tell you that the orthopedic surgeon probably is very skilled and you're in good hands. But the meniscus surgery that you're having is basically a common procedure in general. Discoid meniscus is not a common injury or a common disorder, but meniscus repairs are well tolerated. For the majority of these tears, the pain after the procedure is not terrible, and the pain medication helps very, very well. And I just did a meniscus repair probably an hour and a half ago, but the pain from the procedure really is not that significant. So I wouldn't be worried about the pain, and it is a very common procedure to have done. So I'm sure you'll do well, but good luck. Chandler asked FAI with cam and pincer with superior anterior complete labral tear. So FAI stands for femoral acetabular impingement, which is basically where the hip is pinching on the socket of the hip, and it causes tears of the labrum, which is the stabilizing structure of the hip. And the treatment for that is typically physical therapy, injections, and then if that doesn't work, a hip arthroscopy, which helps to take away the impingement or the pinching areas of the hip. And you also repair the labrum, which is the stabilizing structure of the hip. And this hip arthroscopy is very good at getting patients their pain relief back and getting them back to their activity. So it's a very common issue nowadays, and it's very well treated with hip arthroscopy. So good luck with that. Skipping around here again. So Taco asks, I'm having a knee arthroscopy with chondroplasty and loose body removal. What's recovery like? So in general, knee arthroscopies are pretty common. And so the chondroplasty part of that refers to fixing or shaving the cartilage. So if you have a cartilage issue that is torn, the chondroplasty shaves that area to help to alleviate the pain. And loose body refers to sometimes a loose piece of cartilage basically float around the knee like a pebble. So the loose body removal is that part of the procedure. And if that's all that's happening, that's a pretty minor procedure, and the recovery is pretty quick in terms of going back to activity. Usually, unless there's significant damage to the meniscus or cartilage, a procedure like that, you can walk full weight after the procedure with crutches. So usually within 3-4 days, people are walking with crutches, and then within a week are walking without crutches. So just in general, I would refer for patients for physical therapy after something like that to make sure their knee stays loose and recovery is nice and smooth. So it's not a long recovery for that. So again, skipping around, and send me a DM if I missed your question. Um, so Joshy Pookie Bear says, I need help. I broke my ACL and MCL. What should I do? So ACL and the MCL, the medial ligament, that's a common structure to injure with the ACL. The ACL is the strongest stabilizer in the knee, so stabilizes the knee. And when you don't have the ACL after a tear, basically the knee is unstable. And many times when you have that combination of injury, I would usually recommend surgery for most people because, again, the knee is unstable and causes other issues to occur with the knee. And nowadays the surgery for ACL is pretty straightforward, and there's lots of different options. And for active people who have an ACL tear with an MCL, it is a very reliable recovery to going back to sports, as long as you provide the appropriate physical therapy and are able to complete all the steps necessary for it. So I hear the issue and concern about your injury, but there's a good surgery for it, and I wish you best of luck. Travis Bunner said, 21 weeks after a patella tendon repair, when will I feel normal again? Stairs are still a struggle. So 21 weeks is about 3 weeks after a patella tendon repair. So usually 3 weeks, it takes time to really get your range of motion back after patella tendon repair. So 3 weeks is not a long time. I know it may feel like a long time. So I typically want good range of motion by 6 weeks. So that's really getting your knee to 90 degrees by 6 weeks or so. Depends on the repair. You have to talk to your orthopedic surgeon who did it, but it's going to take a while. Usually I would say close to 3 months is when people start to feel somewhat normal walking around, and that's 3 months. So you're at 3 weeks. So you have a good number of weeks to go. Oh, I'm dividing wrong. So sorry, that's 5 months ago. So yeah, so if it still is an issue, I would say you may want to talk to your physical therapist as well as your orthopedic surgeon. It may be a strength issue if you're still struggling with stairs 5 months after a patella tendon repair. So sorry about that. I was not counting on the fly as well as I should be, but hopefully that helps your question. So him says, I have pain all around my entire knee anytime I jump, land, or bend my knees. I play basketball. I can't give you a specific diagnosis for that, but if you're having pain regularly with any kind of sport, I would always say see an orthopedic surgeon, get an x-ray. It's hard to know exactly what's happening, but if that's not a normal thing for you, it could be a acute injury or some kind of issue that has not been resolved. So Dawson Smith says a thumb UCL repair recovery time. So thumb UCL injury is a hand surgery issue. I'm not a hand surgeon. Sorry, I cannot give you a good answer for that. So I'm not going to try to guess, but I would say on the order of 6 to 8 weeks, but I'm not a hand surgeon. Plenty Bree Wellness Plus Life. Thank you for your question. Yes, had my Achilles repair surgery in October. When will I be back to 100%? So Achilles repair can take, for some folks, 9 months of recovery in terms of physical therapy and really working on getting their leg back, because it can take a long time for that tendon to really recover well and the strength get well. So it can take time. So good luck with your recovery, and hang in there and don't give up hope. Samson asks, does PRP work for torn cartilage repair? So that's a great question. Thank you. So PRP is platelet-rich plasma, which is a concentrated sample of your own blood that has platelets that are concentrated in it. And platelets, the reason why platelets are used is that they have growth factors that can help with healing of certain conditions. For cartilage repair, it doesn't necessarily cause significant cartilage repair, but it can create the conditions to improve the cartilage, meaning it's not like a special injection that can give you new cartilage, but it can give the conditions for improving the cartilage repair. So I believe in using it in lots of different conditions. Cartilage repair can help as well. The only downside with the PRP is that it's a cost issue. So insurance does not cover PRP injections, and so many places they charge a cash pay price for it, and sometimes it's quite expensive depending on where you go for it. So Slade asks, how do you fix a shoulder impingement? So shoulder impingement depends on what you mean by that, but usually that refers to basically the acromion or the top of the bone muscle, top of the bone at the shoulder. It's called the acromion. It's really it sometimes pinches on the rotator cuff and causes pain with lifting or raising overhead. And besides physical therapy, if that doesn't work, one thing that we can do is called a shoulder decompression surgery, where you basically shave down the acromion from the undersurface, and that helps to give more space for the rotator cuff and gives you the ability to lift and not have pain with that. So skipping around questions here real quick. So real quick, Jeff Kai asks, healing time for Achilles tendon rupture, please. So again, I was just talking about Achilles before, but in general, it can take people up to 9 months or so for recovery. Depends on the physical therapy and the strengthening part of it, but it can take a long time. Jay asks, can ACL injuries repair themselves? Answer is no. ACLs cannot repair themselves. They do not heal on their own. People either can do fine without an ACL, because you don't need an ACL to run straight ahead or walk or just do kind of normal everyday activity. But if you have instability where you play sports, do cutting activities, or any kind of high intensity things, an ACL, in my opinion, should be fixed with surgery. Let me see. Poseidon ND asks, how to deal with or get rid of patella tendonitis. Patella tendonitis can be a real bothersome issue for a lot of people, especially people who do a lot of jumping and running. And physical therapy with strengthening of your hamstrings and strengthening your hamstrings and stretching your quadriceps muscle is usually helpful, as well as backing off of the activity that's bothering it, such as basketball or running. If that doesn't work, I'd say if you've done physical therapy, it's still not getting better, usually I tell people to get an MRI, because sometimes people who have patella tendonitis that doesn't go away, they can have some tears or microscopic tearing in the patella tendon that is not necessarily going to get better without a minor surgery. So skip around. X-Man says tennis elbow, question mark. So I guess you mean, can you talk about tennis elbow? So tennis elbow basically is the overuse injury of the forearm muscles that can cause pain on the side of your elbow. And it hurts with a lot of gripping activities. And the reason why they call it tennis elbow is because people who play tennis, usually poorly, have a backhand where their wrist is hyperextended more, and that causes more strain on the side of the elbow. And so the way you treat tennis elbow is to stretch out the muscles in your forearm and do some strengthening exercises as well. And it takes time. So tennis elbow is notorious for taking 6 months to 9 months to really recover from, unfortunately. So it is a painful condition, painful with gripping activities, painful with a lot of stuff. So you got to hang in and do physical therapy for a long time for tennis elbow to really resolve. But physical therapy is pretty much the mainstay. Sometimes injections, which I do not really recommend all the time. PRP injections can help, but the last resort is a minor procedure, which is very rare to do and very rarely necessary. Josh asks, is it possible to come back from a torn ACL and meniscus in 6 months safely? So that's a great question. So the reason why it's a great question is it is still kind of an open area of debate with a lot of orthopedic surgeons in terms of the timeline for recovery after an ACL tear. And the typical teaching, which I usually ascribe to, and I tell my patients, is 9 to 12 months is kind of the average, what I expect for a patient or athlete to come back to sports after an ACL tear. The reason for that is the ACL, once it's reconstructed, it takes at least 9 months for that reconstructed ligament to really turn into another leg to the same ligament again, because there's a process inside the body called ligamentization, and that takes at least 9 months. And that's why 6 months is really too early to go back to playing your sport, even though at 6 months, most athletes feel very good after an ACL reconstruction. They're already running, jumping, sprinting, but the actual knee is not ready because of that biologic process inside of the knee. So that's why 9 months, I would say, is kind of the earliest. It's because of the biologic process. If you go back too early before the biologic process is finished, many times you can risk re-rupturing it. So, but that is a great question. Um, just give me a second. Again, if I miss your question, send me a DM. Jay says, dislocated patella, what's the recovery time? So dislocating patella is very painful, obviously. And initially, the way I treat a dislocated patella is with physical therapy to try to see if just strengthening the muscles and um, tissues around the patella can stabilize it enough. Unless you have multiple dislocations or you have a loose body in your joint, which is basically a torn piece of cartilage that's floating in the joint. If that happens and you have multiple dislocations, then you need to have surgery, in my opinion. And the surgery is very predictable in terms of getting the patella stable and getting patients back to playing sports. So usually after patella stabilization procedure, it takes about 9 months to get back to playing the sport. So I think it's a very good option if that happens, unfortunately. Z asks, I had a revision Tommy John 6 months ago and have lots of inflammation in my joint. Suggestions. Again, I can't give you any specific information about your issue or your procedures since I'm not your doctor, but a revision Tommy John procedure, which is the stabilizing procedure to the medial elbow for a UCL tear. If you're having so for anyone, if you're having new onset of inflammation or pain after things have been normal, I would suggest seeing your orthopedic surgeon and having possibly a repeat MRI to see if there's any issue happening in the repaired area. But again, I can't give you a specific indication on that since I'm not your doctor there. So thank you for your question. You said, do you have a preference for allo or autograft for ACL? So I get this question a lot, and it's a very good question. And the answer to that question is it depends. So allograft basically is cadaver graft, which is donated graft from a dead person, and autograft is graft from yourself. So for an ACL, you have to use a tendon or a ligament from somewhere, a tendon, to make a new ACL. And for younger active people, I pretty much always prefer autograft, which is taking it from yourself. I personally use the quadriceps tendon for most of my ACL autografts for a variety of reasons, mostly because I think it's a very strong graft and people recover very well from it. If you're older or not as active, an allograft is what I prefer because the data shows from multiple studies that allograft or cadaver graft for people who have ACLs, for people who are younger than 40 or 45, and if they're very active, there's a higher chance of re-tear rate if you're young and active and have an allograft. So that's a very, very definitive study, and that's why I definitely prefer autograft for the majority of my patients. Jonathan Nicoletti says, my doc, my right shoulder dislocates all the time. So sorry about your shoulder. I would say, so anyone who has multiple dislocations of a shoulder, you should sorry, you should definitely have it evaluated by an orthopedic surgeon. But what usually happens is the labrum or stabilizing structure of the shoulder tears once you have a dislocation. And once it tears, think of the labrum as like a gasket or rubber seal that goes around the socket. So that rubber seal breaks, and once it breaks, it does not repair or recover itself. So that's why you can have multiple dislocations if that gasket is torn. And then there's also other things that cause it to continue to dislocate. Actually, my latest TikTok video talks about a Hill-Sachs lesion, which is the indentation of the humeral head or the shoulder ball. There's a fracture that happens every time you dislocate. And if you have a big Hill-Sachs lesion, which is that fracture, it can cause the shoulder to continue to be unstable. So definitely have that evaluated. Thanks for questions. Getting thirsty over here, obviously. So Addison Tevez says, what do you think about PRP shot for a partial tear in the UCL, or would you recommend surgery? So that's an excellent question. I actually have done research studies on this. It's published if you want to look it up, if you have nothing better to do, about my research on PRP for UCL. And actually, my studies found that it actually does help in terms of partial tears and helps with recovery. So in general, I would say someone with a partial tear, whoops, sorry. So I would say someone with a partial tear of their UCL, I would try PRP because there is no downside in my mind to trying PRP. And I've had published results showing that there is some good results with that. Lindsay B, great question. Greater tuberosity fracture recovery time. So thank you for the question. The greater tuberosity is a part of the humerus or the shoulder bone that can break when you have a fracture or a fall. The greater tuberosity is an important structure in the shoulder because that is where the rotator cuff inserts. And so sometimes we take it slow in terms of recovery for that. In general, bones take about 6 weeks to heal. And with the greater tuberosity, you want to make sure that the bone is not displacing if you don't have surgery, first of all. So if you don't have surgery, it takes 6 to 8 weeks to heal, and then slow physical therapy during that time as well. If you have surgery, you can move the shoulder quicker and the recovery is a little bit different, but it just depends on whether or not you're having surgery or not. But I would say bones take about 6 weeks to heal. So sometimes it could take that amount of time for the pain to go away. Brian 15 says spiral humerus broke, surgery with hardware. What can I do to gain strength? So I'm guessing you're saying you had a spiral fracture of your humerus and you had surgery with plate and screws. How do I gain strength from elbow to surgery, from the elbow to shoulder? So in general, once the bone heals, which again is 6 to 8 weeks, you can start strengthening any fracture or any broken bone in general if the bone is healed. So we usually wait until that bone heals to start the strengthening process, and that definitely takes a while to regain strength after a traumatic injury like that. So I can't give you a great timeline, but you really can't start strengthening at least until the bone heals, which is about 6 to 8 weeks. And by that time, you have some atrophy of the muscle. So that will take some time to recover from. Zay says, I have a hamstring injury. They told me it was a minor tear, but it keeps bothering me for a year or two. So can't tell you specifically what's happening, but for me, if someone came in with a hamstring injury that's been bothersome for a while, I usually get an MRI to make sure that the diagnosis is correct. And if anything else is actually injured in general, that's what I would do for my patients. Phil Hoops said, shoulder keeps subluxating even after surgery. Had a bony Bankart, what should I do? If you have shoulder issues, such as the shoulder dislocating or coming out of the socket, even after surgery, in general, I would talk to my surgeon to see if there is an issue that needs to be addressed. So you would expect your shoulder to be stable after surgery. So I would definitely talk to the treating surgeon about that. Sophie asks, any recommendations, advice for those who have scoliosis and are physically active? So scoliosis, for those who don't know, is a curvature of the spine. If you have back pain and scoliosis, that's something that needs to be addressed by a spine surgeon, which I am not. But in general, if it's not a huge curve in the spine, which a lot of people have curves in their spine, if it's not a huge curve in the spine, the treatment is physical therapy. If you have back pain and other issues associated with that, then having it addressed by a spine surgeon is the desired treatment for that, and possibly having the curve addressed with surgery. Mackie asks, best advice on recovery from a vertical acute Achilles tear. Again, physical therapy, strengthening takes 9 to 12 months for some people. If I skip your question, send me a DM. I'll try to answer it. So Clutchy asks, thoughts on trimming and removing the edge of a meniscus versus repair? That's a great question. So the meniscus does not regenerate. So my personal preference is to repair as much meniscus as possible, but some meniscus tears cannot be repaired based on the location of the tear, the type of the tear, and the characteristic of the tear, basically. So it kind of is a game time decision for me during surgery whether or not the repair will be performed. And if any meniscus is removed, taking out the most minimal amount is the desired treatment. But I would say, just in conclusion, you take out as little meniscus as possible if you take it out. But nowadays, I try to repair as much meniscus as possible, just because the meniscus is the shock absorber of the knee and you want to keep as much as possible. Miguel Barraza asks, can celiac disease affect you in sports? So that's a very interesting question. Never had that question before. So celiac disease is a GI issue affecting absorption of some nutrients. So I guess the real reason would be whether or not you are nutritionally deficient. If you are nutritionally deficient, then you're not going to be able to perform maximally in your sport. So that really is a nutritional issue. Um, I'm getting a femur replacement for osteosarcoma. So Blake Hopner says, I'm getting a femur knee replacement for osteosarcoma. How good will my knee work post surgery? So thank you for the question, and I hope your surgery goes well. It's a big surgery, obviously, as you probably are aware. And for osteosarcoma, which is a cancer of the bone that can occur in the femur more commonly, if the surgery is going to replace the whole femur, the recovery can be lengthy, but in general, something like that can take months to recover from. But the knee will work because the replacement basically takes over the function of the knee. So you will have a working knee that I am confident that a good surgeon will be able to help you be functional once again. So good luck with the surgery. So ACL. So the question is ACL, LCL, MCL, meniscus surgery in 2021 and still have scar tissue. 19 years old. What do I need surgery? So I'm guessing you're still having stiffness in the knee, and so stiffness in the knee can be treated with physical therapy. But if it's 3 years old in general, so I can't really tell you a specific issue. Because I would have to see your exam. But if I have someone who has stiffness that far out from surgery, it is unlikely to recover without another procedure. So I would definitely have it looked at by an orthopedic surgeon to see if you can have that addressed. So I have about 5 minutes left in this before I have to go. So I'm trying to answer as many questions as possible. But again, send me a DM if I don't get to your question. Um, so Tyler asks, I've had pain under my right shoulder blade when I'm up and moving a lot. What could it be? I can't tell you specifically what that is, but I can tell you that the shoulder blade right around that is basically the muscles for the neck. So anytime someone for me comes in with pain around their shoulder blades, it's really usually related to some kind of neck issue or neck pain. So it's not necessarily a shoulder pain issue when someone has shoulder blade problems. It's really a back pain, neck pain issue that needs to be addressed. So Hope asks, do you have any shadowing opportunities? So thank you for that question. So I do enjoy having students and residents and anyone interested in orthopedics work with me in shadow. Just if you were interested, let me know. Um, so once again, um, so Mo Lester asks, are vertical Achilles tears a real thing? I'm not sure I understand what that question is, so I don't think it really is a real thing. So Casey says labrum pain from a pitcher, can't raise arm above the shoulder. So labrum is the stabilizing structure in the shoulder, and overhand or overhead athletes get labrum issues commonly. If you have pain and can't raise your arms, so definitely have it looked up by an orthopedic surgeon and see the injury to the labrum that you have, and it might be necessary to have physical therapy at least and labrum surgery at the very most. Kate says ACL quad graft return to sport timeline. So thank you for the question. So again, ACL quad graft is my preferred method for taking care of an ACL tear. And usually I would say by 6 months, patients are running and sprinting really by 6 months. 4 months they're running, but 6 months sprinting, running, jumping, cutting, and doing most sports specific activities. But I usually have them go back to their sport at 9 months for the reasons I mentioned before, which is basically it takes 9 months for the ligament that is reconstructed to really turn into a natural ligament inside the body. So that process is called ligamentization. And so 9 months is pretty much the average timeline for me, for my patients to go back to playing their sport. So 2 more minutes. So sorry, I'm going around some of these questions real quick. Ashley says, what is internal derangement of the knee? So internal derangement of the knee is a very non-specific diagnosis of the knee. And that's basically an answer that we give when we are still trying to figure out what's happening inside the knee. So it's very non-specific, can be cartilage injury, can be arthritis, can be a whole bunch of things. So basically it just says there's something wrong inside the knee. So Beach Babe says low grade chondromalacia. So chondromalacia is some wear and tear of the cartilage around the knee. And it just depends on the location of the cartilage injury, the size of it. So it's hard to give you a hard and fast rule about it. The treatment for any kind of chondromalacia non-operatively is you can have physical therapy to strengthen your muscles around your knee. You can have injections for pain relief. And lastly, surgery to fix the cartilage. So I have 1 minute left here. So Dustin asks, are the torn ACL and MCL MRI photos accurate on Google? I'm actually doing a AI project on things like this in terms of looking at ACL and MRIs. But I would say they are in general relatively accurate. Some of them are simplified and generalized, but they're generally accurate. So, but thank you, everybody. I'm being called by the OR, so I have to go. Thanks for tuning in. If I missed your question, let me know by comment or a DM. Thanks a lot, guys. I have to go. Sorry. Hello?
Hey, Dr. Williams.
Hey.
It's Frida. My patient is, the pharmacy said they don't have a script, have prescriptions.
Yeah, that's weird. So I'll call back in.
Okay, thank you.
Thanks for checking. All right. Bye.